Hi, my name is Felicity and I am from One Health International. Alongside with my colleagues Ben, Bianca and Delaney, I'm very excited today to be sharing with you a project called Al Hasba, Improving Measles Vaccination Rates Among Syrian Refugees. This project is to take place in Bekaa Valley in Lebanon, with the expected start date to be January 2019 and expected finish date of June 2021. The project duration is 3 years with an additional 6 months for staff to finalise details. This project will be financed by One Health International, UNICEF and Emel Association International, with other agencies including the Lebanese Ministry of Public Health and Foundation Pierre Fabre also participating. So let's get started. Firstly, what is measles? It is a highly infectious disease caused by a virus. It can easily be spread from one person to another through the air, and symptoms may include a fever, cough, fatigue, sore throat, runny nose, watery eyes, and a rash. However, measles is preventable with a vaccine, allowing the body to build a resistance against the virus. Recently in Lebanon, there have been 603 cases of measles during the first half of 2018. This is a significant increase from the 7 cases found in 2011. This outbreak is attributed to the influx of refugees fleeing from Syria due to the civil war. The refugees live in small condensed areas which may include informal or formal refugee camps, all amongst the Lebanese population. With UNICEF issuing a warning of the lack of funding to support the measles outbreak, our project aims to increase vaccination rates by providing refugee children access to local public health centres where vaccinations may be administered, and to educate communities on the importance to get vaccinated. Currently, household survey results show only 68% of Syrian refugee children under 24 months were documented as having received a measles vaccination, with only 42% of those receiving it through a public health centre. Nearly 8% of parents did not know where to take their children for vaccines, and nearly 5% complained of vaccination locations being too far away or simply inaccessible. The project's main targets are refugee children under 10 years of age that are residing in Bekaa, with increased focus on those living outside of camps in amongst the local population. Unfortunately, isolated refugee children often fall through the cracks and tend to be forgotten during national vaccine programs or any free catch-up vaccines offered by external agencies. Psychological factors such as trauma and poor mental health due to their displacement also increases their vulnerability to the disease. The contagious nature of measles increases the importance for us to ensure all children are fully vaccinated in order to guarantee that the herd immunity will not be compromised. The reason we selected Bekaa as our project location was due to the large population of refugees that currently reside or frequent the valleys in the form of camps and local communities. More alarmingly, only 6% of all public health centres in Lebanon are located in Bekaa, the lowest of any governance. This means that there is a lack of access to the free vaccines for the children. Furthermore, there are continuing psychological factors such as discrimination and legal obstacles in Lebanon that limits the refugees' access to these health services. Therefore, our project rationale is to achieve 2 main obstacles. These include: Number 1, running educational campaigns to encourage and increase awareness of immunisation amongst refugee parents. And number 2, establish and maintain a free shuttle service between local communities and the public health centres, which aims to remove the physical transport barriers. We will continually evaluate the project and receive input from local community leaders, whilst developing a long-term partnership with the Lebanese Ministry of Public Health to ensure sustainability of the project and the eventual complete eradication of measles outbreaks. In order to address the issue of low measles immunisation rates amongst refugee children, in particular children younger than 10 years old, in Bekaa Governorate, the primary objectives of the project are to improve refugee awareness of the necessity to vaccinate children against measles and improve their accessibility to the limited public health centres in the region. The two major project outputs include the provision of health promotion campaigns, which are aimed at increasing measles vaccination rates, with the other output focusing on improving access to public health centres through the provision of community shuttle buses that are free of charge to the refugees. Due to the increased prominence of social media within Lebanon, the project team, in conjunction with the Lebanese social media consultancy, will also serve to produce targeted advertisements that reinforce messages conveyed by the education campaigns. For the first goal, which is to improve refugee awareness of the necessity to vaccinate children against measles, we want to educate parents on the importance of ensuring that their children are vaccinated. This will be done by encouraging parents to keep their children's vaccination cards up to date and fully completed, so that we can track immunization coverage in future projects. Most importantly, we want parents to know that it doesn't matter where you are or where you're from. Staying vaccinated is important and it is free. Our second goal is to improve accessibility to limited public health centres in the region. The main aim is to ensure that all parents, irrespective to their financial status, are able to access the limited public health centres easily and safely through the free shuttle buses provided by the project. We want to remove the main physical obstacle between the free measles vaccination and the child themselves. And these shuttle buses can also act as a conscious reminder for any subsequent vaccination doses that are needed by the children, especially when they are driving around town. It is literally like an ad. For the project to be successful, the initiatives must be able to be sustained after a 3-year duration, which is why we have opted for a community-based approach. Health campaign events will serve as opportunities to recruit volunteers, and leaflets will be distributed and posters will be placed at various locations within the camps, settlements to reinforce the relayed information. The project aims to revisit each refugee camp or settlement once every 6 months over the course of the 3 years to remind and reinforce the knowledge. The role of the free shuttle buses to the public health centres is to increase the accessibility for the refugee parents and children so that they are able to go and get vaccinated easily. Now, the shuttle buses will initially be funded by our project. However, the aim is for our field staff in Lebanon to facilitate discussion and grow a relationship with the Lebanese Ministry of Public Health and a local car rental company so that they are able to devise a contract that can fund the shuttle services in the long term after the project has finished the 3 years run. The use of social media campaigns will be crucial in making our project succeed. They will advertise these campaigns and free shuttle bus service on Facebook, Instagram, Twitter, and YouTube. The targeted advertisements, which will be produced by a local social media consultant company, will reinforce the ideas of vaccinations on a daily basis as soon as someone logs in on their Facebook, Instagram, Twitter, or YouTube account. We may also be able to find volunteers through putting our events on the Facebook pages. To sustain the project, we have opted for a 3-pronged community approach. During the health campaigns, our project staff will actively facilitate discussions with community leaders in order to gain their trust and approval for the program. For programs to be successful, it is crucial that the community is supportive. Secondly, we will actively recruit volunteers at the health campaigns and invite those interested to the training sessions in order to build their confidence and interest in the program. Lastly, we will keep revisiting these areas to re-emphasize the need for volunteers. Simply put, the more the community is invested, the more likely the project will be able to sustain itself in the coming future. However, it is still important to note that we must develop a strong relationship with the Ministry of Public Health in order to sustain this project, and to ensure that we will be able to guarantee funding even after our project has finished. One Health International will play an active role in planning and implementing the immunization education campaigns among the identified target population, as well as collaborating with the Lebanese Ministry of Public Health and partner non-government organizations in field visits to the identified refugee camps and settlement areas to conduct the associated project activities. Additionally, One Health International will facilitate the startup phase of establishing the shuttle service, while also acting as a mediator to facilitate an ongoing partnership and contract between the rental service company and the Lebanese Ministry of Public Health to ensure continued funding and sustainability following the conclusion of the project. Such a contract between a Ministry of Public Health and a rental company may pave the way for future projects that have a similar aim of increasing accessibilities to public health centres.
To actually execute this project, One Health will start with the basics of getting the project running. That will include securing office space in Zali, the largest town in Zali district, and one of the 3 districts in the governorate. Zaleh, along with Roshaya district, will be the primary location for the project. The project staff will be hired, including a project manager, finance and administration officer, and 3 project staff. This team will begin to liaise with community leaders and representatives, Ministry of Public Health officials, partner NGO representatives, and the social media consultancy to get the lay of the land and begin to discuss the particulars of the project implementation. Part of this process will be establishing a steering committee for the measles education campaign, allocating the budget, conducting a context and needs assessment, and a stakeholder analysis. The steering committee should have adequate representation from women, as their input will be critical in the development of the project. Women often make healthcare decisions for the household, so the project must be conscious of how it will reach women effectively. The team will also begin to collect the key information that will comprise the baseline data for the project monitoring and evaluation indicators. It will be crucial to develop strong relationships with the primary healthcare centers, gain their trust, and make sure that they have the resources that they need to participate in the project, including the necessary records-keeping resources and procedures. Also, the project team, with advice from the Ministry of Health and refugees in the area, will develop and procure the immunization cards to be distributed during the project. The cards will be based on the National Lebanese Vaccination Schedule and existing immunization cards. They will also be produced in the local dialect, Leban Arabic. For the shuttle service portion of the project, there will be a separate steering committee. Naturally, the most important activities to do early in this part of the project are to identify a rental company that can provide an appropriate vehicle for the context of the Bekaa Valley and to obtain insurance for the vehicle. However, the steering committee will also liaise with AML Association International and the Foundation Pierre Fabre, which have been involved in the provision of a mobile medical unit in West Bekaa district. The project team will also work with the primary healthcare centers to try and distribute the load of increased visits evenly so as not to overwhelm any of the centers. However, users of the service should not be transported any farther than necessary, otherwise they may not utilize the service in the future. Early project activities will largely center around planning of the project implementation, and once this has reached a degree of agreement and certainty, the team can begin to engage with Petrichor Solutions, the social media consultancy in Tripoli. Over 85% of refugee households in Lebanon own a mobile phone, and over 90% of people have access to one. To take advantage of this fact, Petrichor will assist in developing social media advertising for the education campaign and its primary messages and the forthcoming shuttle service. They will also use analytics to identify the refugees we are targeting as recipients of the project services.
The plan is for the social media-based campaign to run on Facebook, Instagram, and Twitter, as well as making educational videos for YouTube that can be shared across social media. The free shuttle service would also be advertised, whether it's paid on Facebook or boosted on Instagram. We will be able to use Facebook, Twitter, and Instagram analytic tools to measure whether or not our social media campaigns are effective. The data will also help us develop more engaging content for the future.
After 6 months of planning, stakeholder engagement, and preparation, the project will start in earnest. The education campaigns will be conducted in areas or towns with the largest refugee populations. The campaigns will focus on educating the public about the threat posed by measles, the importance of vaccination, including compliance with a multi-dose regimen, the availability of these vaccines for free at primary healthcare centers, and the importance of maintaining an accurate vaccination record for each member of the family. As with the immunization cards, any literature produced will aim to use the language that's accessible by lay people and do so in Levant Arabic. Our project hopes to increase the percentage of vaccinations that are delivered at healthcare facilities and reduce the necessity for immunization campaigns. However, parents will be instructed to make sure that immunization cards are filled out appropriately during the campaign. When conducting the education campaigns, it is important to collect data on awareness of the availability of vaccines, whether the participants came across the social media advertisements, and whether education campaign participants plan to attend PHCs in the future. A key part of the education campaigns is identifying refugees that can become role models and advocates for immunization, and can direct their neighbors, whether refugees or not, on how to make sure their children are vaccinated appropriately. These volunteers can be provided with additional written resources, including extra vaccination cards, and given the contact information of the project staff and local health officials. Every 6 months, each location will be revisited to try and engage with more people that may not have been reached at the previous visit, and to reinforce the messages delivered or provide any updates as necessary. Once the project has procured an appropriate insured vehicle, driver recruitment and training can begin, as well as training runs to get to know the routes the shuttle will take throughout the governorate. Maintenance of the shuttle will be of the utmost importance, so continuing to develop a relationship with a rental agency to ensure the vehicle is serviced efficiently is key during this period. After 1 year, there will be more data collection, analysis, and meetings with stakeholders to discuss project progress and what changes are required to improve delivery. This includes any new strategies for the social media marketing to improve reach and engagement. Once shuttle drivers are trained and routes established, the shuttle service can begin. The drivers will fill logs that detail locations reached, PHCs visited, and the number of passengers transported. This data will be used to optimize the program so that it reaches as many people as possible and does so efficiently. During the second year of the project education campaign, One Health will conduct refresher training and train any new volunteers. Recruitment of refugee advocates will continue, as will data collection for monitoring and evaluation purposes. For the shuttle service, any new volunteers will also be trained and refresher training conducted as necessary. Conduct of the project in year 3 will be much the same. However, focus will begin to shift towards continuing provision of shuttle service after the end of the project. In the first part of the year, One Health will work with the Ministry of Public Health and external funding bodies to secure continual funding of the shuttle service. Then, in the second half of the year, One Health will begin to hand over the service to the Ministry of Public Health and any NGOs that may be involved in the operation. At the end of the project, work will continue to collect the last pieces of data for monitoring and evaluation, and then collating that information. Then, a final project report can be produced and presented to an external group to provide the final project evaluation.
Thanks for that, Ben. Now let's have a look at the numbers. Our project is funded by a total of 3 organisations over the course of 3 years. All numbers are in Australian dollars. The first organisation is One Health International, who will be contributing $240,000. The second organisation is UNICEF, who will be contributing $175,000. Lastly, Measles Association International will pledge $85,000 to the project. This will bring the total combined budget to $500,000. The budget is broken down and will be used in 3 distinct groups of expenses. These are personnel, which includes staff in Australia and Lebanon, training and equipment for volunteers in the field, and in-country expenses, such as rent and transport costs. The personnel expenses for the head office in Australia include the salaries for the admin officer, liaison officer, finance, HR, PR, and operations managers, totaling to $237,270. This amount includes a 5% raise per annum after adjusting for inflation and a raise. The personnel expenses for the field in Lebanon include the salaries of a project manager, finance admin officer, 3 project staff for the first year before reducing by 1 member each year, and a local transportation logistics expert for the first year. Their salaries total to $140,468 and also include the same 5% raise per annum. Also included in the personnel expenses is 2 return flights from Sydney to Beirut per year for Australian staff to travel to Lebanon. Also the visa and in-country travel costs. Training and equipment is broken down into 3 main categories. The first one is equipment, which includes advertising material such as flyers to promote the shuttle service, the production of educational material and handouts in local language, and miscellaneous field equipment, totaling to $9,000. The second is training sessions for volunteers, where they can learn and gain the confidence to provide accurate information regarding vaccinations to the public. These sessions will be conducted every 6 months as more volunteers join the program. The cost will be $4,000. Lastly, $2,400 is dedicated to the running of the free shuttle service, mainly during the first year, with the aim of securing funding from the Ministry of Public Health to continue providing such service in the following years. And finally, in-country expenses are broken down into 4 groups. Firstly, we have allocated $10,800 for the car rental for staff and the associated costs of fuel for the cars. $9,750 is allocated for the office rental costs and basic stationery. $20,000 will be paid to Petrichor Solutions, a local social media company that will design and execute the social media campaigns over the course of the project. Lastly, field staff communication costs, such as the use of mobile phones, will total to $1,080. The budget distribution between the 3 financial contributors is shown on a yearly basis. One Health International contributes a stable $80,000 per year for the project. UNICEF contributes $65,000 for the first year and $55,000 for the subsequent 2 years. Measles Association International contributes $30,000 for the first 2 years and $25,000 during year 3. The staggered distribution for the funding corresponds to the financial needs of each year. Lastly, The project will be evaluated by a private consultant agency at the end of each year to ensure that all goals are met and to provide a final report to stakeholders detailing our financial status and progress. The cost will be $12,000. For any queries, or if you're interested in joining our project, please do not hesitate to reach out to us via our contact details on our website, www.onehealthinternational.com.au. We would love to hear from you. Lastly, from the whole team here at One Health International and on behalf of our partners, UNICEF, Amel Association International, and the Lebanese Ministry of Public Health, we would like to thank you for your ongoing support as we strive to ensure all children become vaccinated against measles in order to end outbreaks once and for all.